Okay. So my name is Ghazala Radwi. I'm a hematologist at the Saskatchewan Cancer Agency in Regina. And my project is about establishing physician wellness as a health quality indicator. But instead of spending a lot of time talking about that, because I think I can do that at the poster, what I decided to do for this is just some reflections and learnings on what we've done for the last 9 to 10 months. So I'd like to start off by saying that I just feel incredibly thankful and grateful for the opportunity to be part of this program. And I'm thankful to everyone that has helped make it happen, and then to everyone that I've participated with, because it has truly impacted my life at many levels. And the project may not have taken off as much as I had wanted it to, but the unintended effects of that were that I have experienced a significant improvement in myself, both as a physician, as a mom, as a person in general. So I'll just touch base a little bit more. So what have I learned? I've kind of divided it, of course, into two portions. So the quality improvement part of it, and just kind of the life and people skills. So some of the things that we've learned together, I thought the elevator pitch was a very useful method in just attaining quality of thought and having a convincing message, knowing why, what your message is, who, and the what. These are a summary of some of the tools that we have used, so from A3 sheets to driver diagrams to how to do run charts, interpret data. If you remember this maze thing that we did when we first started and how difficult it was and how we learned to build a team, communicate without talking, how to build trust and trust your leader and pick your leader, how to have effective meetings. So I thought that was very useful because we meet all the time, and they are not an alternative to working or when you're lonely, as the picture kind of shows there. And then I thought this was really useful in terms of life skills, the instrumental decisions versus fundamental decisions. So instrumental decisions, just a reminder again, these are decisions that you make because you think it's going to lead you somewhere. And it's regardless of whether you enjoy it or not. But a fundamental decision is something that you inherently find valuable, regardless of what it may lead to or not. So I thought that was something pivotal in what we've learned. And then finally, the life skills as well from Dan Pink. So there's no plan, saying strengths, not weaknesses. It's not about you. Persistence trumps talent. Make excellent mistakes and leave an imprint. And finally, just some final thoughts are that for probably just for future incoming cohorts, I think it's really important to realize that there's a time dedication for this program, and the more you invest in it, the more you'll gain out of learning, because there is tremendous learning. It's important to have some clarity of your project idea coming in, because mine I changed kind of quarter way through, and I thought that sort of was also a bit of a barrier and obstacle for me. And then I think just being lighthearted about it all, because we do deal with some very serious situations and quality management and healthcare in general. So to have a lighthearted and kind of fun approach to it always helps. And that's all I have. Thank you.